Hinshaw, our Chief Medical Officer, to provide an update on COVID-19 and to announce another important step in Alberta's vaccine program. We should all be proud of Albertans who have once again come together to protect their neighbours and slow the spread of COVID-19. We're now about 3 weeks out from Thanksgiving and have seen no evidence of a Thanksgiving spike. I'd like to thank Albertans for doing their part to protect each other and our healthcare system. From the businesses that have implemented the restrictions exemption program, to the families who kept Halloween gatherings small, to every person who followed our guidelines and public health rules instead of looking for ways to work around them. Well, you've all proved yet again that Albertans can come together and overcome any challenge. Active cases are currently just over 6,900, and that's a drop of nearly 70% since the peak of the fourth wave on the 26th of September. Our daily case counts and the positivity rate across Alberta also continues to decline at a very good pace. While this is all good progress, it does not mean that our work is done. We've seen a further reduction in the number of Albertans in hospital with COVID-19 as well. Thanks to increased vaccination rates, fewer people are experiencing severe outcomes, and the pressure is starting to be relieved on our hospitals and our wonderful frontline healthcare workers. There are currently 697 people in hospital with the virus. That's a decline of 39% since the peak of the fourth wave 5 weeks ago. ICU admissions have also decreased, in that case by 42% since the end of September, but total ICU occupancy, and that's both COVID and non-COVID patients, is still 139% above our typical non-surge capacity in a typical non-COVID year. And that's why we have to continue to be cautious until the pressure on our intensive care units has reached a more manageable level. About 85% of those in intensive care right now with COVID who are critically ill and fighting for their lives in many cases are not fully vaccinated. Vaccines have been widely available to all Albertans over the age of 12 for months now. We've made vaccines readily available across the province. We provided substantial information on their safety and their efficacy. In fact, just this week, a new detailed literature piece is being dropped at mailboxes and front doors across the province. We've offered $100 incentives, the multi-million-dollar lottery, the restrictions and exemption program is another good reason to get vaccinated. But for those who continue to sit on the fence, I urge you to seek out credible sources of information. Please speak to your doctor or a pharmacist and make the choice to get fully vaccinated as soon as possible. There is no question that the biggest factor in our decreasing COVID numbers is the recent increase in the number of people getting the jab. In total, more than 6.5 million doses of COVID-19 vaccines have been administered. This includes more than 800,000 doses since the launch of our $100 financial incentive at the beginning of September. And that's an average of nearly 16,000 doses a day in the nearly 50 days since the restriction exemption program was introduced. Today, 87.2% of the eligible population, that's everyone 12 and over, has at least one dose, and 80.6% are fully vaccinated with at least 2 doses. We've gone from being about 10 points behind the national average to only about 1.5 points, 2 points behind the national average. Thank you, Alberta, for helping us to catch up. That's an increase of nearly 9% over the past 6 weeks in the number of fully protected Albertans. I want to thank Albertans who have rolled up their sleeves and made the decision to get vaccinated. I know it may have been a difficult decision for some, but it's a decision that will help protect you, your loved ones, and our healthcare system. While it's important for every Albertan to get vaccinated, we know that some folks are at a higher risk of severe outcomes, and that is why we have followed the evidence and ensured that residents in congregate care settings, seniors, frontline healthcare workers in those settings, and people who are immunocompromised were the first to be vaccinated. It was the right thing to do, and the data confirmed it. Within weeks of starting to vaccinate these individuals late last year, we saw a dramatic drop in the number of cases and severe outcomes. Make no mistake, vaccines have saved lives. We began giving booster doses to seniors in congregate care on the 1st of September, becoming one of the first provinces to do so. To date, close to 40,000 seniors in those facilities have received their third doses, their booster shots. In addition, more than 180,000 immunocompromised and other at-risk Albertans have also received a third dose, a booster dose. Based on recommendations from the Alberta Advisory Committee on Immunization, on October the 6th, we also began offering Albertans aged 75 and older and First Nations, Métis and Inuit people aged 65 and older a third dose of COVID-19 vaccine to boost their immunity levels and continue to be safe. To date, over half of Albertans over the age of 75 have, I should say, and over at that age and over have received additional booster doses. It's a good start. And I'm pleased to announce that starting Monday, even more Albertans will be eligible to book a booster shot at least 6 months after they receive their second dose. Based on the latest evidence from both the National Advisory Committee on Immunization and the Alberta Advisory Committee, booster doses will be available to all Albertans aged 70 and older, as well as all First Nations, Inuit, and Métis people aged 18 and older who are both on and off reserve or on and off settlement when they are 6 months or more from their second dose. So just to make that simple, anybody who is 70 years of age or older in the general population can now book a booster shot, a third shot, as long as 6 months have passed since they got their last shot. And some may ask, why are we making this more generally available to the First Nations, Indigenous communities at 18 and above? Well, the data sadly shows that Indigenous people have suffered significantly worse outcomes from COVID-19 than the general Alberta population. And this is a reflection of that higher level of risk. We want to provide that protection to anybody who might have an elevated risk level. We are also offering additional protection for healthcare workers, providing direct patient care who received their second dose less than 8 weeks after their first dose, because the data shows that the closer the interval, perhaps the less durable the protection of those vaccines. And anyone who has received only viral vector vaccines, for example, 2 doses of AstraZeneca vaccine, will now also be eligible for additional doses. Minister Copping will provide additional details on all of this in a moment, but as I mentioned before, the expansion of eligibility for additional doses follows the latest scientific recommendations from the National Advisory Committee on Immunization. The latest evidence shows that vaccine effectiveness may decrease over time in individuals who fall into one of the 4 groups that we've just mentioned. At the moment, there is no evidence or scientific advice that the general population needs booster doses now, but please rest assured that we continue to follow the data very closely, and if and when we receive scientific advice that points towards a need for booster doses in the general population, we will make sure that Albertans get them efficiently as long as that 6-month interval has passed. And I should add that for the vast majority of people, they have not yet passed that 6-month interval, so opening up access to booster doses for the general population would not be relevant right now. It won't be until December that people will begin under the age of 70 broadly to qualify. So thank you, and with that, I'll invite Minister Copping to provide more details on the rollout of these third booster shots.
Thank you, Premier, and good afternoon, everyone. Today marks another milestone in our ongoing fight against COVID-19 in Alberta. We're getting past the 4th wave, with cases and hospital admissions dropping for 5 straight weeks. We're going the right way, but we need to stay the course and prepare for the future. Vaccines continue to be our most effective tool against the virus. And today's announcement of third dose boosters is an important next step in our vaccination program. I know that it's welcome news for many Albertans and their loved ones. As the Premier mentioned, just like the initial rollout of COVID-19 vaccines in late 2020 and early 2021, we're protecting those at highest risk. There is emerging evidence that shows immunity may decline faster in certain groups. So we're expanding eligibility for third doses to 4 groups. First, any Albertan age 70 or older. Second, all First Nations, Métis or Inuit people age 18 and older, regardless of where they live in Alberta. Throughout the pandemic, Indigenous people have been more severely affected by the virus, due in part to underlying health conditions. And by offering boosters, we hope to see a decrease in the number of people going on to experience these severe outcomes. The third group we're offering boosters is to anyone who has received 2 doses of viral vector vaccines, meaning AstraZeneca and Janssen, including people who received the Janssen vaccine outside of Canada. Now, we're offering booster doses to these Albertans because the emerging data suggests the protection from viral vector vaccines decreases more quickly than mRNA vaccines. And finally, the fourth group, we're offering boosters to healthcare workers who provide direct patient care and receive their second dose less than 8 weeks after their first dose. Boosting their immune levels will help prevent them from spreading COVID-19 to patients and others at high risk, and also protect them as well. Now, the data shows that among fully vaccinated people, older people have the highest hospitalization and mortality rates from COVID-19. So that's why when we started the rollout for third doses, we included the rollout for residents in congregate living facilities, individuals with severe immune compromising conditions, any Albertan 75 and over, and First Nations, Métis, and Inuit individuals aged 65 and older. Now, we're expanding those groups today, and we strongly encourage every Albertan aged 70 or older to book an appointment for their third dose starting next Monday, November the 8th. Remember, you need to book your appointment for a date at least 6 months after you received your second dose, which right now means in April or earlier. This time frame is needed in order to generate the strongest immune response possible. Now, if you fit into one of these eligible groups, but aren't yet at the 6-month mark since your second dose, now don't worry. There will be a vaccine available for when it's your turn. And for anyone hesitant about getting vaccinated, I know there's a lot of misinformation out there, and many people have fears from the vaccination. But that's why it's so critical to seek out accurate information from trusted expert sources to help you make an informed decision. Talk to your physician, talk to a healthcare professional, call 811, and make the choice with the right information and protect yourself, others, and our healthcare system. Now, I know this pandemic has been an incredibly tough journey for every Albertan, and it's been especially tough getting through this fourth wave, but we are getting through it. Our vaccine rates are continuing to close the gap, as mentioned by the Premier, with the national average for both first doses and second doses. And our current public health measures are working, including restrictions on social gatherings, the indoor mask mandate, and the restriction exemption program. But I will continue to stress caution as we move forward. We need to continue to follow these rules because the fourth wave continues to take a toll, including the postponement of surgeries. We have a lot of work still to do, but there is light at the end of the tunnel. AHS is restoring surgery volumes as fast as they can as the pressures on ICUs decreases. Volumes are now at approximately 2/3 of normal surgery levels and climbing, and I expect the situation will continue to improve. But there are still hundreds of Albertans every week not able to receive surgery that they need. And I extend my deepest sympathy to those patients and their families. And I want them to know that I'm supporting AHS in ramping back up surgeries as fast as possible. And as capacity recovers, AHS is giving priority to Albertans who are the sickest, including cancer patients. And I'm very grateful to hear that cancer surgeries have fully resumed. No more cancer surgeries are being postponed due to the COVID-related capacity constraint. And I'm working with AHS to develop a plan to get us back to 100% of normal surgery volumes as soon as possible, and then beyond the 100% to start working down the backlog. But getting there depends on all of us in keeping cases low. So that's why it's so critical for government and AHS to work together to increase vaccination rates, increase capacity in our healthcare system, and encourage people to follow the health restrictions that are currently in place. So I want to end by thanking all our healthcare workers. It is because of you that we've been able to manage through this fourth wave and previous waves. Thank you. So let's continue to support them by working to get the fourth wave behind us, getting vaccinated if you haven't already done so, and getting the information that you need, following the restrictions in place, and keep not only get through the fourth wave, but keep it from coming back. So thank you, and I'll now invite Dr. Hinshaw to provide today's COVID-19 update.
Thank you, Minister, and good afternoon, everyone. Before I get to today's numbers, I want to briefly talk about vaccination records. Anytime you receive an immunization, whether it's for COVID-19, seasonal influenza, or anything else, you should be given a paper record of immunization that shows what injection you got, as well as where and when you got it. In Alberta, the immunization provider then uploads that information to the Provincial Immunization Repository, so it becomes part of your official electronic health record. Lately, we've seen an increase in the number of Albertans who say they've received the COVID-19 vaccine, but their online record is missing. In some cases, the individual has received an immunization from out of province or out of country, so their original record of immunization simply needs to be uploaded to Alberta Health Services. However, we are also seeing instances where individuals claim they've been vaccinated against COVID-19, but they can't provide the original documentation, or the documentation they have can't be validated. As Alberta Health Services cannot accept verbal history for proof of immunization of any kind, re-immunization of anyone without validated proof of vaccine is recommended to ensure the individual actually does have vaccine protection and to make sure that there is an accurate record of vaccination. This is standard practice in these situations and is not specific to the COVID-19 vaccine. If you are missing immunization records, you can contact HealthLink at 811 for more information. Turning to today's numbers. Over the last 24 hours, we identified 487 new cases of COVID-19 and completed about 10,300 tests. Our positivity rate was about 4.8%. Cases in school-aged children continue to decline. There are currently active alerts or outbreaks in 184 schools. Of these, 4 schools had 10 or more COVID cases who attended during the last 14 days while infectious. As the Premier mentioned, there are currently 697 people being treated for COVID-19 in hospital, including 155 in the ICU. Sadly, I must announce that 14 new deaths were reported to Alberta Health in the last 24 hours. My thoughts are with those left behind to mourn these individuals and anyone who has lost a loved one to any cause. As the Premier mentioned, throughout the month of October, we have seen a sharp decline in our cases across the province and across Albertans of all ages. We have passed the peak of the fourth wave thanks to the targeted public health measures we have in place and our rising immunization rates as more eligible Albertans choose to be immunized. This combination is helping to reduce the demand for acute and critical care for those with COVID-19, making third doses available as of next Monday to an additional 600,000 eligible Albertans 6 months after their second should also help make a difference. As Chief Medical Officer of Health, I fully support the expanded eligibility for booster doses, as the evidence has shown protection against severe outcomes may decline faster in these groups. I know that many Albertans may be wondering when their turn will come and whether they should also be getting booster shots. I'd like to be clear that at this time, the evidence does not support a need for boosters in the general population where most people received their second doses at a longer and more effective interval from the first. We will continue to monitor all emerging evidence on vaccine effectiveness across Canada and around the world, and will bring forward recommendations on additional boosters for the public if needed. We will also stay on top of recommendations from the National Advisory Committee on Immunization and the Alberta Advisory Committee on Immunization and keep Albertans informed when information is available. Thank you, and we're happy to take questions.
Thank you, Dr. Hinshaw. Just a reminder to our journalists gathered here in person today to please state your name as well as the outlet you're with, as well as who you're directing your question to. And just a note that Dr. Verna Yu is available for to answer questions as well via teleconference. So with that, Graham Thompson with iPolitics, go right ahead.
That's right. Question for the Premier. Surprise, surprise. But don't go too far, Dr. Hinshaw. Sir, on a few days ago in the House, you were asked why you did not take measures as the fourth wave began to rise in August. And you said, basically, because you got no further recommendations to take more action. If you had got those recommendations, you would have taken immediate action with the Cabinet Committee. Now, that looks like you're actually blaming then Dr. Hinshaw. You're saying we took no action because Dr. Hinshaw did not recommend any actions. Now, sir, you know, you've said yourself, the final decision rests with you, and by publicly talking about what recommendations you have or haven't gotten from the Medical Officer for Health, it seems that you're sort of breaking a protocol here, a very important one, to discuss this by, in a sense, blaming or seeming to blame, shift the blame to Dr. Hinshaw.
Well, I think that's a completely ridiculous misconstrual of what I said, Graham. I've always said, as I did multiple times in the debate in the legislature on Monday night, that I take ultimate responsibility as the Premier, as the President of Executive Council, for our policy. And we receive advice. When we do, we take it very seriously, and we act quickly. When we receive advice, I was being asked a series of questions about what kind of advice we received and when, and what the government did about it. I was being transparent. I don't think that's, I do think that's what the public expects is transparency. So, as you know, I think on July 28th, the Chief Medical Officer, Dr. Hinshaw, announced a number of measures to move Alberta from pandemic to endemic management, and those decisions were endorsed by Cabinet and by myself. A couple of weeks later, in mid-August, when our health officials saw that we were not experiencing the degree of decoupling between new cases and hospitalizations that we had expected, we received advice to suspend or delay a number of those measures that had been announced at the end of July. I immediately convened a meeting of the COVID Cabinet Committee and ratified those recommendations. And then in late August, when we saw the situation deteriorating in terms of hospitalizations, another set of recommendations were brought forward, and then we immediately began the decision-making process, which resulted in the September 3rd measures that were announced, including, for example, province-wide indoor masking requirement. We closely monitored the situation and move forward with yet additional measures about 10 days thereafter, including the restriction exemption program. So this is not about blame. I was simply being transparent about when we received information or advice. We've always sought to act promptly with advice that we've received, to treat that advice with the greatest of seriousness. But ultimately, it's up to the ministers, the elected people in government, myself included, for the decisions that are made.
And
follow up to Dr. Hinshaw, if I may, just on the same topic. What you thought of the comments from the Premier, because I'm going back over most of the year and a half of the pandemic. When we asked you what recommendations you've made, you say that's between you and the government. This summer, you publicly started talking about your recommendations in terms of moving to an endemic state, and now you've got the government openly talking about the recommendations you've made or haven't made. So can we expect now, well, first of all, your reaction to the Premier's comments 2 days ago, and can we now expect you to start discussing the recommendations publicly, like you have in the past? This summer.
Thank you for the question. When I read the specific comments that were made in the context of a timeline in terms of timing of when different pieces were brought forward. They accurately reflected what I brought forward, and so as I'm sure you all know, the recommendations that were brought forward early in the summer based on what we knew at that time, based on our projections at that time, based on the experience of what we thought were comparable jurisdictions, I did bring forward a recommendation to move to endemic, which was accepted. As you know, I made that announcement on July 28th. And again, as you know, we started to see some evidence of the non-ICU hospitalizations not behaving as we had anticipated, so paused any further movement to endemic. My team and I monitored very closely the data over the ensuing weeks to determine whether or not the decoupling was happening as we would have anticipated. And then when it became clear it was not, again, moved to put forward the contingency planning and recommendations that we had prepared. So with respect to the specifics of which exact recommendations were brought forward, of course, those are the things that are part of Cabinet confidence in those deliberations. But in terms of discussing those timelines, the timelines, again, are not necessarily something that's new in terms of those conversations. With respect to what will be brought forward in future, again, the deliberations that are made in confidence are protected, and those are things that I've sworn an oath to not disclose. With respect to my own thinking as I have moved through the pieces of information that, again, are public with respect to what recommendations I've made and when, that's something, again, that my own assessment of public health risk, and again, the timing are things that at this particular moment, of course, we're having that conversation. Whether or not, depending on the future, what kinds of things are protected by Cabinet confidence, I would have to take advice on. Again, I take my oath very seriously. I also take my responsibility to the Alberta public very seriously and make the best recommendations I can at every given point along the way.
Thank you, Dr. Hinshaw. Janet, you can go ahead with your question.
Hi there, Janet French from the CBC. It's a question for the Premier. So a former government employee alleges that Agriculture Minister Devin Dreeshen engaged in excessive drinking and inappropriate conduct at work. Who is investigating Minister Dreeshen's behavior? And if no one is formally looking into this, why not?
Well, my Deputy Chief of Staff, responsible for human resources, is primarily responsible for receiving information of concern about conduct of people in the legislature and the political side of government. And if you're referring to statements made in a statement of claim, the government will in due course be responding to that. As you know, with respect to, there were complaints about inappropriate comments being directed at female members of government staff by one particular individual. I am briefed that we only received one actual complaint in that context. And that complainant said, I believe to the CBC, that, quotes, at or around the same time as the allegation contained in the claim, I reported a personal incident of sexual harassment regarding Ivan Bernardo. The Premier's office immediately contacted me and handled the matter with compassion and professionalism. At no time did I feel unheard or dismissed. To the contrary, this matter was handled and resolved to my satisfaction, unquote. I respect the perspective of that complainant who suggests that the process worked with respect to her complaint about harassment. We take these matters very seriously, and we have in fact instituted a mandatory respect training program across the government, including the public service, members of the legislature, ministers, and their staff members. We also have a code of conduct that is presented to ministers and MLAs, as well as political staff, to which they have to sign their agreement. And we've also contracted an expert in workplace safety and safe working environments to review our policies and procedures and advise us on whether we need to do anything better or differently.
Do you have a follow-up today?
Yeah, with respect, I'm not talking about the conduct of your staff. I'm talking about the conduct of one of your cabinet ministers. Given these allegations of his inappropriate behavior, which he has not denied, why is Mr. Dreeshen still in your cabinet?
I am not aware of any allegations of harassment with respect to that individual, and we have a process to deal with allegations of harassment. Of course, we expect and encourage all members of government broadly to treat others with civility and with respect, and that is something that we is, of course, an expectation we have for everybody. But when it comes to individual personal relationships, those are things that I don't comment on.
Thank you, Premier. Audrey, go ahead.
Hi there, Audrey Neveu from French CBC. Ooh, this is a little high. Premier, if you could answer in French and English as usual, thank you very much. What message does it send to women generally, and also women who work for your government, that Minister Dreeshen, given the allegations against him, is still in your cabinet?
Well, again, as I said, you want me to say that in French? Because I just did in English to CBC, so I'm sorry.
Could say
En
both.
français, vous voulez?
Well,
Pour dire,
specifically to that in English too, please.
pour dire que, comme je viens de dire, nous encourageons tout le monde de respecter leurs collègues avec respect et nous prenons très au sérieux n'importe quelle allégation de harcèlement. C'est la raison pour laquelle nous avons eu depuis le début de notre gouvernement un processus clair à cet égard. Comme vous savez, une femme qui a déposé une plainte contre un autre personnel politique en ce qui concerne les allégations d'harcèlement a dit à Radio-Canada que sa plainte a été traitée de façon respectueuse et professionnelle et elle apprécie la réponse prompte du bureau du Premier ministre, de mon bureau. Quant aux relations personnelles entre les gens, c'est pas pour moi de commenter sur les relations personnelles, mais j'encourage tout le monde de traiter les autres avec respect et dignité.
Okay, just to be clear, you're talking about the private relationship of Minister Dreeshen. Is that what you're referring to?
Well, I'm responding to your question about, I think you said you implied a statement of claim where somebody indicated that they had a relationship. I'm not comfortable commenting on the details of a personal relationship, particularly since I'm not privy to them.
Okay, on completely another topic, Bloc Québécois leader Yves-François Blanchet said today that in a question about the Alberta's equalization referendum, said that he would welcome constitutional talks, but he would also include, and that's a party promise of his, to include green equalization, where Alberta would technically have to pay for its GHG emissions. So do you feel like you've kind of opened a can of worm here?
No, I think this is a typical provocation by Monsieur Blanchet, who, loves Alberta bashing. It would be nice if for once he stood up as the leader of his fringe party and expressed some modicum of gratitude to Alberta for Albertans for having generated tens of billions of dollars of wealth that's been transferred to benefit Quebecers over the past recent decades. The night I was elected as Premier, I spoke to Quebecers in French to say I wanted to renew the historic alliance between Alberta and Quebec, to be partners in prosperity. And I'm disappointed that some leaders like him seek constantly to divide. The reality is this: for people like Mr. Blanchet, who want further to attack Alberta's energy industry, they are doing they are effectively advocating, whether they understand it or not, for the OPEC dictatorships in Vladimir Putin's Russia. Because if this energy is not produced by Canada at the highest human rights, environmental, and labor rights in the world, then the energy will be produced and sold by Putin's Russia, by the theocracy in Iran, by the Kingdom of Saudi Arabia, and by the socialist dictatorship in Venezuela. That's bad for the world environment, and it's bad for human rights. And I would call on Mr. Blanchet to to be to realize the degree to which Quebec has benefited from the development of resources here in Alberta. I'll say, you want the same in French, I presume. C'est épouvantable que M. Blanchette divise les Canadiens. Ben, ça, c'est son but. C'est la division du Canada. Alors, ce n'est pas exactement surprenant qu'il trouve n'importe quelle façon à s'attaquer à une province, Alberta, qui a partagé les dizaines de milliards de dollars de nos richesses avec nos amis québécois pendant les décennies, dans le système de péréquation, entre autres. Et la soirée que j'étais élu comme Premier ministre de l'Alberta, j'ai parlé aux Québécois en français pour dire qu'il faut renouveler l'alliance historique entre les deux provinces pour protéger les champs de compétences des provinces et il faut être les partenaires dans la prospérité. Alors, moi, je n'engagerai jamais dans le Québec bashing, même M. Blanchette, il joue avec l'Alberta bashing. Je crois que c'est une marque de division. Et en bout de ligne, lui, M. Blanchette et les autres comme lui, ils défendent les intérêts économiques et stratégiques des pires régimes au monde. Parce que si le Canada ne développe pas nos ressources naturelles, la Russie de Vladimir Poutine, les dictateurs en Iran et l'Arabie saoudite et Venezuela, ils le feront. Ils fourniront l'énergie au monde si le Canada ne le fait pas. Alors, j'espère que M. Blanchette considère vraiment que les Albertains doivent être les alliés du Québec. Mais enfin, c'est un séparatiste, alors ce n'est pas exactement surprenant.
Okay, you can go ahead with the last question of the day before we hop over to the phones.
Thank you. Question for Minister Copping. This is Lauren Boothby with the Edmonton Journal and Sun. Hi, Health Minister. I want to ask what happened to the wastewater testing that was supposed to roll out across the province. Was that meant to replace case testing, and so you canceled that now that you've brought it back, or is it still coming, and where is it at?
So we are performing wastewater testing as we speak. It is across the province in multiple locations. We're improving. We just actually recently signed an updated agreement with the University of Calgary to get that more quickly. One of the challenges is in terms of the testing, it's sometimes a week to 14 days behind, but we're improving that process and we're continuing to watch that among the other metrics that we're watching in regards to how COVID is impacting and moving about in the population.
And do you have a follow-up today,
I have a
Lauren?
follow-up for Dr. Hinshaw. Hi, Dr. Hinshaw. I want to go back to the earlier question on your recommendations and the timeline. So you said it's cabinet confidence, but the Premier has basically thrown you under the bus when he gave his account of what you said. I think Albertans deserve to hear the truth. Kenney even said, like, Albertans deserve transparency, and that's why I was telling them that. So in interest of that, can you tell us, did you recommend the government act sooner to bring in stricter restrictions like the passport? What can you tell us?
Thanks for the question. So just want to go through that timeline that I spoke about a little bit earlier to be clear about the kinds of things that were informing the recommendations that I made. Again, as you know, end of July was the initiation of a move to an endemic approach, and that was based on the analysis that we had done, comparing with other jurisdictions, with the modeling that we had at that time based on the available data. And we moved to that first step. In the ensuing weeks, saw that there was a deviation of the non-ICU hospitalization from what was anticipated in that forward projection, and therefore paused, made recommendations which were accepted by Cabinet that paused the movement forward to allow us some more time to monitor. In the subsequent weeks, we were watching very closely. And while there was a rise in cases, which we had anticipated would happen, again, that was always something that we had assumed would happen, is that cases would go up. We did see that non-ICU hospitalizations were increasing, but ICU hospitalizations were remaining relatively low and tracking in a stable way along a low trajectory. So we continued to make plans in preparation in case that changed. And when we saw the deviation of the ICU begin to change at the end of August, we moved very quickly to then bring forward additional recommendations and put those in front of decision makers to deliberate and decide upon. And again, as you know, there was an announcement about measures on September 3rd. So with respect to that timeline, again, the things that I personally have always taken very seriously are the responsibility to minimize the direct impacts of COVID on the population and the responsibility to minimize the indirect impacts of COVID restrictions on the population. So in those weeks in August, as my team and I were very closely monitoring all of those different metrics, the concern that I would have had about moving very quickly in response to cases was the concern that if we had seen a decoupling, as we anticipated we would, if we had seen that and we moved to minimize case transmission, we could potentially have been inflicting the indirect damage where it wasn't needed. When we saw again that decoupling was not happening, we did move very quickly because at that point in time it was clear the direct impacts of COVID outweighed those indirect impacts. And again, that timeline in terms of the public health rationale is where the planning came from and where the advice came from with respect to that particular time frame in August.
Thanks, Dr. Hinshaw. We only have time for about 2 calls today, so operator, can you please put through our first caller?
Thank you, Bob Weber, Canadian Press.
Hello, this is a question for the Premier. Mr. Premier, I've got a question about COP26. You said earlier this week that you likened what's going on in Glasgow to a gab fest and said there was really no benefit. It wasn't worth Alberta's time to send a large, high-level delegation the way other provinces have. Given the importance of the decisions that are being made there, given the size of the financial institutions that are there, the media attention, and given the fact of a new environment minister there, do you regret the size and the status of Alberta's representation in Glasgow?
No, this is a meeting involving 30,000 people where decisions are taken by national governments. We're not a national government. We make clear to the Government of Canada very clearly the views of Alberta and about the need for cooperation on emissions reduction with economic growth. So we will continue to have those discussions and we will continue vigorously to defend Alberta's interests. But putting a few more people in a conference with 30,000 delegates where there are, I gather, something like, well, there are 400 private jets injecting about 13,000 tons of CO2. I don't think that would be defensible. I know that Premier Notley sent a large delegation, herself included, to Paris for several days. And I'd like to know what tangible progress was achieved, because as far as we can tell, the answer is precisely nothing. So we will continue vigorously to defend Alberta's interests in emissions reduction and economic growth to ensure a strong future for our responsible energy sector. But being part of a crowd of 30,000 people is not, we think, an effective way of doing so.
And Bob, did you have a follow-up today?
Sure. I mean, every other province has sent significant delegations. They've sent environment ministers. Industry has sent delegations. Suncor has sent. CAP has sent people there. NGOs are there. First Nations are there. Why wouldn't you want to be there if for no other reason to tell Alberta's story in front of international media?
Well, Steve McDonald, the head of emissions reduction in Alberta, is there to tell Alberta's story about emissions reduction. We tell that story all around the world. We've created a environmental, social and governance secretariat at the heart of Alberta's government in Executive Council to increase our public education and advocacy efforts with respect to the huge environmental progress being made in and by Alberta's energy industry. The Canadian Energy Centre is launching large-scale public information advertising campaigns around the world. I myself have, I'll tell you, I find much more effective sitting down one-on-one with people, as I've done in amongst global financial leaders in places like New York City and London, then being part of a crowd of 30,000 people, and we'll continue to have those direct conversations with key decision makers. Finally, part of the context here, of course, is that when Alberta declared a state of public health emergency on, I believe, September the 14th, we indicated to ministers that they should avoid non-essential travel, and we're also respecting that protocol as long as there is a state of public health emergency.
Thanks, Premier. Operator, can you please put through our last question of the day?
David Staples, Edmonton Journal.
Hi, Premier and Dr. Hinshaw. My question is about, given the harm that comes from both the lockdown and discrimination, do you guys have any concerns that the government and private business is laying off people and putting them on unpaid leave, unvaccinated people, that this is an overreach? And if you don't have a concern, why not?
Well, David, I think it's entirely reasonable for employers to want to maintain safe workplaces, and we do know that vaccination reduces the risk of infection and transmission, that it radically reduces the risk of severe outcomes. And so I think it is legitimately in the interest of employers to maximize vaccination rates within their workforce. I think there are certain workforces where that is more obviously the case than others. One example would be in our hospitals with Alberta Health Services, because we have a duty to care through our hospitals and our hospital workers, so it is not acceptable for people to be working with patients who may be more vulnerable to infection if they themselves are not vaccinated, and hence the vaccine mandate there. Now, what I'll say broadly as an employer, the Government of Alberta, is that we have introduced through the Alberta Public Service Commission a vaccine mandate with a option, which is a regular negative test option. And so for employers who are concerned about maintaining workforce, that is one option. I think that those who choose not to get vaccinated could come in with regular negative test results to demonstrate that they don't constitute a higher risk of transmission or severe outcomes. Employers in Alberta, through the Workers' Compensation Board system, have had to pay, I believe, over $36 million in WCB-related claims for people who have had to take sick leave because of COVID infection. I've been in discussions with some of the major employers who've introduced vaccine mandates. Some of them have flagged with me that they're also concerned about legal liability. If they don't have a vaccine policy and people become infected, develop severe outcomes and potentially even die. And so many of them believe that they are acting to responsibly to protect their workforce, and that they have an ethical and legal responsibility to do so. So, as I say, I think one alternative here is a periodic or a regular negative test option. That's what we've also done here at the Alberta Legislature. And I don't know if Dr. Hinshaw, she doesn't have any additional comment on that.
Okay, do you have a follow-up, David?
Yes, you've talked about looking into having a program where people with acquired natural immunity, like people who have gotten COVID in the past, get to go to places under the vaccine exemption program. Why isn't that not yet in place?
Yeah, actually, I had one other point I was going to raise on the first question. I'll come to your second, David, which is that many of the employers that you're talking about, like, for example, the big oil and gas companies that have brought in various kinds of vaccine mandates, almost all of them, I believe, have regular drug testing programs. That's one example of the protocols they have to ensure fitness for duty and that workers don't constitute a risk to their fellow workers. In terms of the question of immunity following prior infection, when we discussed the adoption of the restriction exemption program, I did raise a number of questions about whether we could incorporate into it a proof of immunity through prior infection like Israel has done through their Green Pass system. Now, I believe that the vast majority of jurisdictions across the Western world have adopted various kinds of proof of vaccination programs, but I believe Israel and maybe only one other country have incorporated into that a proof of immunity through prior infection. But I have asked Alberta Health to explore whether we could integrate that into our REP program. The reason why it just wasn't feasible at the beginning is we had to move very quickly. And I know, David, you were advocating for this at that time in early mid-September. We had to move very quickly to reduce transmission and to try to do that in a way that wouldn't force business closures. And so the proof of vaccination program became really the only viable alternative. It was either that or overrunning the hospitals or massive shutdowns of businesses that would have had its own devastating impact. So we determined the REP was the best way to proceed, but we simply couldn't get a system like that up and running that would incorporate proof of immunity through antibodies acquired through natural infection, because, as you know, those antibodies and their protective effect wane over time. They do so unequally, so there's not one homogeneous immune response across the population from prior infection. So you would have to set up some kind of a testing regime. You'd have to do it periodically to see if people still had acquired immunity. It would become extremely complex. How you would then integrate that into the proof of vaccination codes and so forth were multiple levels of logistical complexity that we simply could not incorporate into the program. But as I say, I have asked Alberta Health to take a closer look at what they're doing in Israel and whether that could be incorporated here. I got to be honest with you, we've been so busy with so many tasks, I haven't heard back at this point. But I think there is. I understand the point that people make, that if they have acquired immunity through prior infection, I understand what they're saying, that should somehow be recognized. I point out that we do recognize that. We do recognize that in our modeling, the protective effect of prior infection. We also have reflected it in our public health rules, for example, saying in the past that individuals who have immunity through prior infection do not have to self-isolate if they have been the close contact of somebody who has tested positive. So we have recognized this as the meaningful protection that these antibodies can offer. But ultimately, what is clear, David, is that especially from the big Maccabees Health Management Organization study in Israel, is that the most effective protection you can have is to have antibodies through an immune response to prior infection plus a vaccine. So we would say to those folks, we get it. Immunity following prior infection is good, but vaccines are better. And we also know that so-called natural immunity can wane over time. The vaccines provide that additional level of protection. So for those who have been sick, got recovered, and believe they have immunity, fine, but please still get the additional protection of the vaccine. That's our message.
Thanks, Premier.
Sorry, that answer was way too long. I apologize. Are we done? Yeah. Thank you very much, everyone.